Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Hanan binti Muhammad Muhyiddin. I will present about radiographic testing is a non-destructive testing method. The discovery of X-ray. In 1895, Wilhelm Conrad Röntgen, a professor at Würzburg University in Germany, was working with a cathode ray tube in his laboratory. When he noticed some crystal on the table near the tube giving off a fluorescent glow, what surprised him was that the tube was shielded by thick black paper and none of the light rays should have been able to penetrate the paper and have an effect on the crystal. He concluded that the tube was emitting an undiscovered type of ray that was capable of passing through the paper. In 1895, he started experimenting with this new discovery, and on further investigation, he found that these rays could even pass through human skin but not bone or metal. The first X-ray he managed to capture onto photographic film was his wife's hand. Next, the production of X-ray. Electrons are emitted thermonuclearly from the heated cathode and are accelerated toward the anode. When they strike it, X-rays are produced. X-ray emission is the inverse of the photoelectric effect. The radiation produced by the X-ray tube is created by two completely different physical mechanisms, continuous and characteristic X-ray. The continuous X-ray or Bremsstrahlung was created when free-moving electrons electromagnetically interact with nucleus, while characteristic X-ray form during the electron transition processes that occur when an inner shell electron is released from an atom. Expression of X-ray's Bragg's equation. The equation for Bragg's law is n lambda equal to 2d sine theta, where lambda is the wavelength of the X-ray, d is the spacing of the crystal layers, theta is the incident angle, and n is an integer. The principle of Bragg's law is applied in the construction of instruments such as Bragg's spectrometer, which is often used to study the structure of crystal and molecule. Moseley's equation. Moseley's law is an empirical law concerning the characteristic X-rays that are emitted by atoms. The law was discovered and published by the English physicist Henry Moseley in 1930. This equation is known as Moseley's law, which Fk equal to 2.48 multiplied by 10 power of 15 Hz multiplied by z minus 1 power of 2. Where Fk is frequency of the K line and Z is atomic number of the target element. Next, the history of radiographic testing. The history of radiographic testing actually involved two beginnings. The first commenced with the discovery of X-rays by Wilhelm Conrad Röntgen in 1895, and the second with the announcement by Marie Curie in December of 1898 that they demonstrated the existence of a new radioactive material called radium. Radiographic testing or industrial radiography is a non-destructive testing method of inspecting materials for hidden flaws by using the ability of short wavelength electromagnetic radiation to penetrate various materials. Radiographic testing method is nothing but to take the shadow picture of an object onto a film by the passage of X-ray or gamma ray through it. It is the same as the medical radiography X-ray, only difference in their wavelength. Radiographic testing principle. In radiographic testing, the part to be tested is placed between the radiation source and a piece of sensitive film or detector. Once the X-ray or gamma ray radiation is started, the test part will hinder some of the radiation by its material density and thickness. Thicker and more dense material will allow less radiation to pass through the specimen. The film records the amount of radiation that reaches the film through the test specimen. By studying the radiograph data, defects can easily be recognized. If the material is sound without any defect, entire rays will evenly pass through the material. But for materials containing flaws, rays passing through the flaws will get absorbed to a small extent due to the change in density. Defects in parent metal reduces its density and hence they transmit radiation much better than the sound metal. Hence, the radiograph film appears to be darker at the area exposed by the defects. The penetration power of rays are dependent on the energy of the radiation. Radiation having higher energy can penetrate thicker and denser materials, as high energy X-ray and gamma ray are highly radioactive. Local rules must be strictly followed. In radiographic testing, defects are detected using thickness variation. So, larger the variation, the easier the defect is to detect. But when the path of rays is not parallel to a crack, the thickness variation is less and this crack may not be visible. That's why it is always suggested to perform radiographic testing by sending rays at various angles. Radiographic testing procedure. Depending on project requirement, the radiographic testing procedure will vary a little. This is one of the sample procedure steps for radiographic testing. Step 1. Surface preparation. Surface irregularities must be removed so that they cannot mask or confuse the image as defect. The finished surface of all but welded joints should be flushed with the base material. Step 2. Selecting the right radiation source and radiographic film. Depending on radiographic sensitivity and material thickness, radiation source, X-ray or gamma ray must be decided. Step 3. Selection of penetrometer. Step 4. Radiographic testing technique. Single or double wall exposure technique is used. Step 5. Defect inspection and removal. Step 6. Record all the data properly. Application of radiographic testing in industry. Radiographic testing of welds to ensure the weld quality is a widely used industry practice. Radiographic testing in welding is a highly dependable way to detect weld defects like cracks, porosity, inclusion, voids, lack of fusion in weld interiors. Because of its high dependability, radiographic testing is widely used in the oil and gas, aerospace, transport, military, automotive, manufacturing, offshore, petrochemical, marine, and power generation industries.
Self-awareness. Why X-ray is dangerous? X-rays can cause mutations in our DNA and therefore might lead to cancer later in life. For this reason, X-rays are classified as a carcinogen trusted by the World Health Organization. The next point is the key risks in X-ray exposure involve damage to living cell tissue. Though the body usually can repair damage to cells, high-level exposures to radiation are often linked to cancer, chromosome mutations, congenital abnormalities, and infant mortality rates. And why X-ray is important? X-ray is important because it's non-invasively and painlessly help to diagnose disease and monitor therapy. It support medical surgical treatment planning, guide medical personnel as they insert catheters, stents, or other devices inside the body, treat tumors, and remove blood, clots, or other blockage. The advantages and disadvantages of using X-ray. For advantages for the X-ray is, it is cheaper and simple technique. It has lower radiation compared to CT scan. X-rays are not absorbed very much by air, hence specimen need to be in an evacuated chamber. It helps to diagnose tumors easily without need of surgery. It also widely used by radiologists to identify cracks, for infections, to identify level of injury, and to identify abnormal bones. It also helps to locate alien objects inside or around bones of humans. For the disadvantages, it does not provide 3D information. Bones can block significant diagnostic data as it absorbs the radiation. They do not interact very strongly with lighter elements. Due to its radiation, it mutates cells which cause ionization. This often leads to cancer. It does not produce the best image, but medium quality image. Next is social responsibility, issues related with the X-ray. Most diagnostic investigations will not have an adverse effect. Procedures with higher doses such as CT, interventional procedures or multiple exposures could lead to biological effects in some cases. A higher absorbed dose means a higher risk of adverse effects. The relationship is almost linear. Adverse effects could include skin redness, infertility, cataracts, and hair loss. There are no reports of radiation exposure in diagnostic and interventional procedures causing infertility or cataracts. Patients undergoing interventional procedures that require fluoroscopy that lasts 1 hour or more could, in very rare cases, experience radiation-induced skin injuries called erythema. Diagnostic X-rays and nuclear medicine examinations lead to a slightly increased risk of cancer. This risk increases with the magnitude of the dose and with the number of procedures. The X-ray radiation center does not align with the image center, which means a few situations occur where you cannot get the image center and the radiation centers to align. The effect of this challenge is that part of the object might be missing in the image, making it difficult to make an accurate assessment, which causes inadequate results. And how to prevent unwanted event of X-ray? So, you need to ask if a protective shield can be used. If you or your children are getting an X-ray, ask whether a lead apron or other shield should be used. Tell the X-ray technologists in advance if you might be pregnant. Keeping the time exposure to minimum. Maintaining distance from the source when appropriate. Placing a shield between yourself and the source and protecting yourself against radioactive contamination by using proper protective clothing.